CHF affects millions of people in the United States. It is important for you to understand what CHF is and how to manage it. You are going to meet Addie Johnson. She is a 68-year-old woman with a history of atrial fibrillation, hypertension, diabetes, and is a current smoker. She began feeling shortness of breath on any activity, even when laying down. She also noticed some swelling in her legs. She went to the hospital where she was diagnosed with CHF. Listen closely as her nurses explain how to take care of herself when she goes home.
Hi Mrs. Johnson, I'm Jen. I'm going to be your nurse today, and I wanted to teach you a little bit about why you're here in the hospital. So I've got a binder for you. It's got some learning materials. You'll go over it. Let me know if you have any questions.
Okay.
It talks about things you need to change and habits that you need to adopt. So I'm going to start out teaching you about your heart.
Okay.
Okay, so tell me what you know about the reason why you're here.
Well, they told me that I have heart failure, and I only know a little bit about that. Something about my heart not working completely as it should.
So I can start by telling you a little bit about CHF, congestive heart failure. I'll show you a diagram of a heart here. When you look at the heart, you can see that there's valves going between the top and the bottom of the heart. And one of the causes for congestive heart failure can be that your valve doesn't close all the way, and so it creates the blood to flow in the opposite direction that it's supposed to. Another cause for CHF is, through lifestyle habits, smoking, not eating the right foods, high fat, high sodium. It can decrease your heart's ability to contract and pump blood out. So that's a little bit about your heart. I wanted to talk about, you came in here for swelling in your legs and shortness of breath. Now, if this ever happens to you again, that would be a reason to check back in with your primary doctor, see what adjustments you need to make. You're taking a pill to get rid of the excess fluid, your diuretic. They may need to adjust that if you have buildup of fluid again. I also wanted to talk about things that you should be watching while you're at home. So you want to check your weight every day. Same time during the day. You want to see if you're gaining any weight. That could be a sign that you're retaining fluid. So if you notice a 2 to 3 pound increase in your weight, that means you need to contact your doctor and see what may be going on. It's important to take your medications. I know that was something that you were having a hard time with. Did you not want to take your medications?
Well, whenever I would take it, I couldn't sleep at night because I had to go to the bathroom all the time.
Okay, well that can just be a simple matter of changing the time when you take it, because if you take your diuretic right before bed, it's going to keep you up all night, so maybe during the daytime that would be something you'd be able to do. There's a lot to talk about regarding managing your CHF. I want to encourage you to read through this packet, all the information that you have. Just look through. It'll be a couple days, and you'll be learning lots of information, but feel free to ask any questions, things that relate to you specifically, things that you like to do in your diet and your lifestyle.
Thank you.
Mrs. Johnson looks through her educational packet overnight.
Hi, Ms. Johnson. My name is Lynette. I'm going to be your nurse today. How are you doing?
I'm doing a little better.
Good. I see that you're looking through your learning packet.
Yes, there's a lot of information in here.
There definitely is. And,
A little overwhelming.
It definitely can be. Over the next couple of days, though, we're going to be, your nurse yesterday went over some things. Tomorrow another nurse will come in before you go home. And feel free at any time to ask any questions. So with heart failure, it's important to have restrictions on salt. Anything that has salt or the 2 little letters Na, that means sodium. Sodium makes you retain water, fluid in the body, increasing pressure on the vessels, on the heart, thus increasing your chances of higher risk for heart disease and having a stroke. And we definitely don't want that to happen. Okay, so it's recommended sodium is only 2,300 milligrams per day. The average person has about 3,000 or more. A lot of prepackaged foods canned foods. A lot of those
Top ramen.
contain sodium. Yes, top ramen. You know, I know it's not easy, but you know, fresh is best. You know, lean meats, chickens, fish. Limit your alcohol intake. That doesn't mean you can't ever drink, you know, but maybe reduce the amount that we drink. Maybe a glass of wine a week. Oh, sorry, I know. Okay. Also, it's important to exercise. Activity is an important thing also. 30 minutes a day is recommended. In your wellness journal or learning tools, there's also a few exercises that you can do. Sitting in a chair, some simple leg raises, arm raises, you know, just a little chest stretching. There's simple things that you can do while in a chair. So I know that you smoke. Can you tell me how much you smoke a day? How many
2
cigarettes?
packs.
2 packs, okay. Wow. So it's important with heart failure for us to also, well, for you and myself, you know, to kind of get you on the path to reducing the amount you smoking so that eventually you stop smoking. You know, cigarettes, nicotine, tobacco, those things also increase your heart disease and increase your chances of getting a stroke even more. And like I'm going to keep repeating myself, I know nothing's going to change overnight, but if we can set a goal of maybe by the end of the month, from once you leave, that you reduce your cigarette intake to maybe a pack a day, you know, and I know that sounds like a lot to you right now, but there are prescriptions, you know, there are medications that have come out such as Nicoderm, that's gum, that you can chew that help reduce your cigarette intake. Also, there are many support groups that help with smoking. Do you have any questions for me at this time?
We have barbecues in my family a lot. And what types of food can I eat at a barbecue?
You know, we're being realistic. We're all human. We're not expecting you to cut out everything, but everything in moderation. You know, if there's, you know, a grilled chicken versus a grilled steak, go for the grilled chicken. You know, if there's potato salad, just get a little bit. You know, you don't have to have seconds, but just get a little bit so that you're not overdoing it. You know, it'd be unrealistic for me to ask you to change your diet overnight and your lifestyle. So it's the little things that'll start to make that change. Any other questions I can answer for you?
Right now, I think I'm just gonna think about everything that you have told me and remember some more questions.
Right, and I'll be popping in throughout the day, so feel free to ask any questions.
Okay.
Alrighty?
Thank you.
Good morning, Ms. Johnson. My name's Ashley. I'm going to be your nurse today.
Hello.
How are you feeling today?
A lot better.
Yeah? Since you came in?
Yeah.
I'm so glad to hear that. So I'm going to be getting you ready to go home.
Oh, yay.
Yeah. Did you come up with any questions after looking through your packet?
I did. I had one question. In here it was talking about going to the lab.
Right.
And it seems like I'm going to have to go to the lab a lot more now.
Yeah, so it's really important to just keep up with the lab work and really monitor your blood pressure and your labs. The doctor's going to be ordering that for you. It's really important to keep an eye on your blood pressure and your cholesterol and all those things. So
Keep an eye on my blood pressure at home?
yeah.
Oh, I don't know how to do that.
Okay, so that was actually the first thing that I was going to go over with you. There's some things that you can buy at the store where you can actually get a machine that will take your blood pressure for you. That's available at Target and places like that. It's really important for you to check your blood pressure because you're going to be on some medications. I actually have a list for you. We started you on them here in the hospital, but something called lisinopril and Coreg. Those are things that can affect your heart rate as well as your blood pressure. So those machines are something that you probably want to go purchase so that you can check that blood pressure daily.
What if I don't have any money for it, something like that?
Well, we have resources that we can help you with and provide those things for you if that's something that you need help with.
Okay.
And then also we have this logger that you can log your blood pressure and just kind of make sure it's within that range that your doctor wants it. And if it's not, then that's when you're going to want to call your doctor and maybe have a follow-up and if your blood pressure is too low, you want to call the doctor before taking that medicine that day.
Okay, and then take the log to the doctor, right? So we
Right,
can
right.
check.
Yeah, so we can
Okay,
keep
Miss
an eye
Johnson,
on
so I
that.
just have some questions I wanted to ask you just so that we're on the same page. I want to make sure you understand everything before we kind of send you home.
Okay.
So tell me a medication that is something called the diuretic.
That's that Lasix.
Yeah.
Mm-hmm.
So what does it do to you? What is the Lasix? What's the purpose of taking it?
Gets rid of my water.
Good.
Mhm.
Yeah, that's why you're taking it. So
Right.
it's really important that you take that and you don't skip doses of your medicine. They all have importance and the reason why you're taking them.
Right.
Can you tell me maybe another food that has a lot of water in it?
Watermelon?
Right. And maybe it's popsicles. Those are all things that you don't really think about as
Right.
far as fluid, but that adds to your fluid.
Mm-hmm.
And then do you remember how much fluid you want per day?
They said 2 liters.
Good. Yeah. Yeah. So those are all important to just keep them in mind. We talked about the importance of going to the doctor and following up on your labs. Also, if you have any shortness of breath or chest pain, those are things that are you're gonna want to go straight to the ER. You don't want to call the doctor and wait for them to call you back.
Right.
So just go straight to the ER if you have something like that.
Okay.
If you have something like swelling in your legs or your blood pressure, is starting to get low or high, not within the range on the log, those are the things that you want to call your doctor for. And then I also have some support groups here that we offer here at the hospital. Do you have any friends or anybody that you know that has heart failure?
No friends.
No? Okay. Well, it's great just to, have people that are going through the same thing. It's always good to have support and, you might have questions or, things that you want to change in your lifestyle and other people have already been through that. So it's great to kind of go to those and there's times here that you can look at.
All right.
Yeah.
Okay. Like a little CHF dating,
Yeah. Yeah. Are you single?
Yeah.
I mean, maybe you can meet somebody at a support group. Johnson, do you have any questions for me?
I think you all have covered everything.
Great, I'm glad to hear that. And I'm so glad that you're feeling much better.
Yes.
I'm glad that the start of this track, it's just the beginning. So it's good. It's normal to have questions, and you can always write those down and follow up with your doctor. There's great resources in there and numbers to call. I know it's a lot, and you'll probably have more questions after this. So that's why I encourage you just to go to the support groups and do your follow-up care because this is just the beginning of your journey. So
Thank you.
We hope that this video was educational and informational for you. If you have any additional questions, please read through your educational packet that was provided with this video and feel free to call any of the resources provided in the packet, and we hope that you have a wonderful day.